House says yes. The university is dropping students from its health care program and blames Obamacare. Michael Hernon is Vice President of Advancement at Franciscan University. He joins us. Good evening, sir.
Good evening, Greta. It's great to be with you.
It's nice to have you, sir. So you are eliminating health care for students. Why?
Yeah, it is actually a very troubling decision that we had to come to. Franciscan University is very passionate about our Catholic identity, and as soon as the Obamacare HHS mandate came out this past summer saying we had to cover things like drug-inducing or abortion-inducing drugs and contraceptives, we knew we were going to have some problems and we could not comply with that law. But then just recently we found out from our health care provider for our students that the cost would be doubled to our students. And we find both the moral and the economic to be completely incompatible with what we're trying to do at a Catholic university.
With the question of the Catholic identity, the intensity of it, though, why is that not a reason for you to likewise take the employees off off the health care? Why only students for that portion of your motivation?
Yeah, well, we're going to be fighting, as we started back in the summer or early fall, fighting for religious liberty, and we'll continue to do so. For our employees, the direct impact economically doesn't hit us as of today, but it does impact our students. We require our students to have this, and we think it's a very reasonable thing to offer affordable, basic health care for our students, but now it's both the moral and the economic that's hitting us today. We probably have another year that we are still hoping to battle and win on religious liberty, but the economic issue hits the student plan today.
What's the reaction from the student body and their parents?
Yeah, we sent this out in actually mid-April to the parents and students, and every response that we've gotten is positive. Since this story broke in the last 24 hours, I've gotten a lot of alumni and even benefactors of the university saying, "Way to go, Francis, have courage, stand up for your principles." And so so far, there's plenty of people who are concerned, saying, what are going to happen to these students? And we're concerned as well. We have a health clinic.
But let me ask you this, if it's to stand up for the principles, and correct me if I'm wrong, the principles I would think would go to the Catholic identity issue and the drugs and the contraception, but you're not doing that as to the employees. It seems to be an economic argument for the students, at least more so, at least that trumps it in the short term, that's the more weighted decision.
It's the trigger that forced it. Probably if it was just the economic alone, it might not do it. But we know if something doesn't change between now and then for our student health coverage plan, we would not be able to comply in the near future based on Obamacare's HHS mandate. And so when you combine them both together, it really changes the entire conversation for us. And our students have been out there in front really saying we cannot comply. Our president said, this is something we'll die on this hill. We cannot let religious liberty stop us.
What's the cost difference? Have you figured it out?
Yeah, so our students right now are paying about $600 for their health plan, and this would go to about $1,300 in the first year. But then they say it could be upwards of 3 times as much in the second year, and they can't even estimate what the third year would be. And any idea what the cost is? The university pick up some of that cost? Do you have a companion cost to that, or is this solely the $600 versus the $1,300? Is that's the complete cost, and that's the student bears it? That's what the student bears, and in these tough economic times, we're not compelled by any law to offer this. We just thought it was a good and advisable thing. Either they're covered by their parents' plan, or they pick up this extra plan.
Does this cost you at all then? I mean, if the students are picking up the $600 to go to the $1,300, does it cost the university any money at all to have this for them?
It's 100% what we see as a burden on the students directly. And what we have done, like many colleges, we actually required health care coverage. So what we've done is said, we're no longer requiring you to have health coverage to come to Franciscan University.
All right, so that's where the difference is. You're not requiring the students to buy it. Before they had to buy it, so I understand it.
Yeah.
Michael, thank you. What? I'm sorry, sir?
No, I just think that, we've now heard that there's another university considering this. This is a major issue, and, our First Amendment freedoms affects not just Catholics, but really all Americans. And this is something that I really think we need to continue to battle with today. We can't just let this kind of go down and not be really aggressive and really out there and letting our voices be heard. So I really appreciate the time on the show today, but this is an issue that's bigger than just Catholics.
Michael, thank you.
Great, thanks, Greta.
Coming up, global gridlock.